Good evening, everyone. Good evening, everyone. It's 6 o'clock. We're going to call the Macomb County Community Mental Health Board full board meeting to order. And I'm going to begin by reading the mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. Next is adoption of the agenda. Motion by Seer Material, support by Burke. Any questions on the agenda? All in favor signify by saying aye. Aye. Opposed? Motion carries. We will now follow the agenda. Next is item number 4, and that's a hearing of the public. Is there anyone from the public that would like to address this board? You have 5 minutes to do so. Anyone from the public? There's somebody from outside the public, but that will not count. So we'll move on then to item number 5, which is the minutes of the regular meeting of the board that was held on November 19. And those are in front of you at your desk. Motion by Bush, support by Fantuzzi. Any questions or comments on the minutes? All in favor signify by saying aye. Aye. Opposed? The minutes are approved. Next is approval of item number 6, approval of standing committee meeting minutes, which include Policy and Legislative Affairs Committee, Recipient Rights Committee, Personnel Committee, and Program and Budget, and another Personnel Committee.
Move to approve items 6A through E in their entirety.
Support.
Motion by Kraft, support by Phillips to approve item number 6A through E in their entirety. All in favor signify by saying aye.
Aye.
Opposed? Those minutes are also approved. Next is item number 7, and that's a request to approve various contracts and other items that we had discussed in detail at our program and budget meeting 2 weeks ago, or a week ago. And tonight is our opportunity to ratify those decisions. Motion for all of them? All right, for items A through J? Nick?
Yeah.
Okay, and motion by Seer Materials, support by Bush. Are there any questions or comments on any of these, Linda?
I just want to, make known publicly to the board that the Authority Task Force, although they approved, and they did, the request was for an additional 6 months, that we made it very clear at the last meeting that we want to wrap it up as soon as we can, as soon as all the information that we have, and that we hope to do, a way to end any disruption to the staff and the providers and so forth. So the message is that we're going to try to get it wrapped up much sooner than the 6 months if possible.
Great, thank you for that reminder. Anyone else? All in favor signify by saying aye. Aye. Opposed? So those requests are all approved. Next is item number 8, any correspondence to receive and file. Did we receive anything? Nothing there. And item number 9, resolutions. And let's just take them one at a time. Starting with item C. Joyce Schleicher. Motion by Bush.
Support.
Support by Phillips. All in favor signify by saying aye. Aye. Opposed? All right, Joyce can retire. Next is Kathleen Parzinski from the Office of Substance Abuse. Motion by O'Connell, support by Bush. Any comments, questions? All in favor signify by saying aye. Aye. Opposed? So Kathleen can retire. And item A, having gone in reverse order. Randy, oops, I missed, Randy O'Brien, okay. I don't know, is he? Yeah.
If we don't
There's
pass,
this-
you can't retire.
Reluctantly.
There's this long pause, nobody's saying anything. Okay, the motion dies for lack of support.
I'll make it and wish them such
I could make it a pending speech.
There we go. Motion by Bush, support by Burke. And I heard an amendment to that only if we can hear a speech. Yes, yes. Yeah, yes. Don't put that in the minutes. That was said in jest. All right, all in favor signify by saying aye.
Aye.
Opposed? Motion carries. How many years?
Almost 17.
Oh, okay. But
a life before this.
Yeah, I had the same job in Lansing for 9 counties for another 15. I've
Okay.
been in the business for about 40 years.
great. Thank you.
I have some remarks to make, but I'll wait till after the business is conducted.
All right. Well, he wants to make sure this motion carries and sticks. All right, then we have item number 10, and that's the voucher listings, the list of bills.
Move to pay the bills.
Support.
Motion by Kraft, support by Schmidt. Any comments or questions on the bills? All in favor signify by saying aye.
Aye.
Opposed? The bills are paid. Next is item number 11, the management report.
Well, good evening and welcome to the last board meeting of the year and right before Christmas. On the official side, it was from the Community Mental Health Association's weekly update. Governor Whitmer has passed the supplementals, which would restore some of the $947 million in the line item vetoes. So the budget continues to go back and forth a bit at the state level. We're getting paid, which is good, although there's still some problems with the way we're being paid. But it does restore, specific to kind of our side, $1.25 million for the autism navigators and $350,000 for the autism intervention statewide. I did meet with the Autism Alliance of Michigan on behalf of all of the PIHPs. We're part of that Michigan Consortium on Healthcare Excellence. So Brad Casemore and I met with Dr. Colleen Allen. We do have some shared interest, and we're going to continue to meet, so we got off to a really good start. Governor Whitmer is also, as Linda had brought up last time, she's pausing the Medicaid work requirements. I'm sorry, the headline says pausing the Medicaid work requirements could save the state $40 million. So there's a cost to implementing the work rules. But they continue to move forward, actually. So that's folks with Healthy Michigan are primarily the ones that would be affected by the work rules. People that are receiving services through our, if they qualify as intellectual and developmentally disabled or an adult with severe mental illness, the state has exempted them already. So the folks on Healthy Michigan, and then even more so because of the privacy rules specific to substance use, those folks have to go through an individual exemption process and notify the state. So we're trying to get the word out. That goes into effect January 1st. And hopefully will minimize the impact on people and the system. CCBHC is another acronym. It's the Certified Community Behavioral Health Centers. The extension is, including Michigan, is looking promising. So the state did reach out to agencies who had expressed an interest in becoming a CCBHC, and we were part of that. That happened before I arrived. But I did notify the department that we would be interested in future activities in that area. So part of our planning going forward will be to look at the readiness tool for becoming a CCBHC, and it provides a good model of integration going forward anyways. But we might have an opportunity to become official. Other updates. The Milliman, we actually have an agreement, but it was a small amount, so it didn't come up to your level. Milliman is the actuarial firm that does the capitation, Medicaid capitation rates for the state of Michigan. So the state gives them our claims data to process. We had to pay Milliman a licensing fee to get access to our data, which seems a little uncalled for, but there was a $1,000 licensing per license fee to get access to that pool of data. The good news is it's organized in a pretty easy to use way with pivot tables, and but it also gives us access to the entire state. So we can now compare our data to the entire state or to an individual county. So we could compare our data use in a specific service area to Oakland County, to Wayne County. So we just got access, or getting access to that. The emails came over today. But it gives us another source of data, which hopefully will be very helpful. I wanted to thank staff for an excellent holiday party on the 12th, and I wanted to thank the board members who were able to attend. I think it does go a long way with our staff to see the board members there, and it was greatly appreciated. Actually, I spent a couple of days with Tony. So Tony was at the holiday party, and then on the following day, on Friday the 13th, Senator Pete Lucido had a coffee and conversations at the Shelby Senior Center. So we were over there. And Senator Lucido is talking about, and will work on planning, a town hall in April specific to autism services. And actually, the one family member he mentioned, I was able to make contact with that parent today, and we have follow-up activities in place. And I mentioned the Autism Alliance. A reminder of the Metro Region meeting. That'll be on Thursday, January the 16th at 6 p.m. The buffet, the dinner will be served at 6:30, so try to be there by 6:30. Parking, hopefully they have their parking open at the Detroit offices. The address is on the flyer. Parking is historically bad for that building, but at that time of night we should be okay. The other meetings upcoming, the program and budget meeting for January will be Wednesday, January the 8th at 6 in this room. The January board meeting will be on January 22nd at 6 in this room. We have a recipient rights appeal committee Friday, January 3rd, right after the new year, at 7:30 a.m. at our administrative offices. And I think that concludes my
There's a
updates.
request for another one.
I'm sorry?
There's the request for another appeal hearing.
Oh, it's January 13th or 14th?
Right.
Do you want board members to respond to you with their preference?
That would be good.
Can we set it tonight?
Yeah, so a second recipient rights appeal committee for January 13th or 14th at 7:30 a.m.
Is that both, or is it just one?
No, one or the other, so. One or the other, the 13th or 14th?
Right.
one on the 3rd.
There is one on the 3rd, and a request for a second one to be either the 13th or 14th. So,
It's a Monday and a Tuesday.
Anyone cannot make the Monday, the 13th? Well, you're going to be gone regardless the next day, too?
I'm in and out the same day.
All right.
Back on the 14th.
All right. How about the 14th? 14th can't be there? All right, so more can be there on the 13th. So we'll set it for the 13th. Monday, January 13th. Okay, continue.
Well, that was the end of my report, so
Okay.
thank you.
All right, thank you. Next is other agenda items, and I have one on your desk in front of you. There should be the single sheet of paper on the top. It's titled Annual Evaluation of CEO David Pankatai. And one of the requirements of the board is to perform an evaluation. And we had mentioned when we'd approved his next labor contract, that sort of serves as an evaluation, which it does. But I thought it would also be good to just codify our evaluation in another way as well. So if the board members could take the time tonight before you leave, fill that out and turn it in if you haven't already done so. Just turn it in to me. Thank you. Anyone else? Any other board members with anything? Okay, then that leads us to item number 13, which is hearing of the public. Is there anyone from the public that would like to address this board? You have 5 minutes, and if you could please identify yourself.
Hi, I'm Lori Doyle, Peer Support Coordinator, and I'm here with another peer to share their story. This is Rod Winters. He's a parent support partner at Specialized Children and Family Services, and he's been with us since 2012. So he's going to talk about his story.
Hello. My first experience with CMH was I adopted a son that was developmentally delayed. As a matter of fact, when I picked him up in foster care, he was in at Harbor Oaks. Did not know what I was getting into. But along with him came this program from CMH, was the SED waiver program. Didn't know what it was, but I just know that these people were there to help me. And it was a blessing. Very, very hard. But I was able to get the help I needed, and I took advantage of the things they wanted me to do to support my son. And one of them things was to take a class for trauma. And in that class, it's like a 6 or 7 week class. The supervisor, who's my supervisor right now, is she asked me if I wanted to come to work for them as a parent support partner because she was impressed by what I had been doing with my son. So I took it on part-time. Before that, I was an auto mechanic for 30 years. So I mean, I knew nothing about services or anything like that. And so I took on the job. There's like a year-long training with it, going back and forth to Lansing a few times, and then monthly phone calls and stuff like that with for training. And then that's how I started. I love being a parent support. It is, when I say I love it, I don't want to say that I would work for free, but I love doing it. You know what I'm saying? And if I was cornered, I'd probably do what I'm doing to some sort of extent, as a volunteer. It's a great program. We work with the parents of children that have special needs, and the parents they're great. I love every family that I work with. And if I can, I would like to maybe just share with you a couple of my families of one that I started off with first, and to kind of show that what we do as parent support partners. And I remember when I was green. I didn't really know exactly what all I was doing, but I walked into this family. It was a mom. Her kids just came out of foster care, and she looked at me when I walked in. She says, "I don't want to lose my kids." And I'm thinking, that's not what I'm here for. I'm here to support you. I'm not here to try and do anything like that, you know? But she was scared. So what I was able to do is work with a mom that had 2 children, lived in a small 2-bedroom mobile home, and lived on $1,000 a month and some food stamps, and made it. You know, and I was impressed by her, and as we developed our relationship, as it is support partner, is partnership along with her, and in the 3 years that I worked with her, she had came from where she was to, like, her child was had no hospitalizations, her child was doing good in school, and just a complete. She moved out of that small 2-bedroom. Mobile home into a beautiful bungalow. She got married, you know, just a great story. And I played a part in that. Not that I did anything. You know what I'm saying? I just went alongside of her and allowed her to be who she was, and help her not to fear that someone's coming in to take her kids, you know, and that kind of affected me, you know, that she thought that of me, but she's one of my favorites that I ever worked with. You know, eventually we have to, you know, give our families up, and they go, because they get better. And that's our job, is to let the families get better and not need us. And that was a success story. There was maybe some other things, issues or stuff that she maybe needed to work on, but she knew how to work on it herself. And she could do it. Now, that was one of my first families I worked with. Second family is a family that I just started working with. Great family, has it all together. You know what I'm saying? I mean, I meet with them and I think, well, what can I do to help you? You know what I'm saying? You're better than me at this, you know? But as you guys know, our services change a lot. And for them, things have changed, and they're kind of nervous about it. So I feel that where I'm going to work with these people is to help ease that for them, and help them to understand that services do change. That, you know, people come and go, and just to help them along through this journey that they're going through with their son. And it's a really cool job, and I love it. And thank you guys for allowing me to be a part of this community and serve the people that need it. You know, people that are judged, people that are maybe sometimes looked past, and I get to go in there and work with them and develop really friendships with them. One of the things that I love most with working with the families, and this happens with just about every family I've ever worked with, is, you know, you go in there and they kind of support partner, what do I need, you know, and I tell them, this is a service for you. It's not for your child. We're here because of your child, but we're here for you. And then, yeah, okay. But usually about after 2 or 3 meetings, they look at me and say, Rod, you really do get it. You know, because I've lived their life. I'm living their life. I still have a couple of kids at home that I come up with new stories to share with my families every day. And you know, it's a hard ride, but it's a very fun ride. And I love working with my families, and that's it. Thank you.
Thank you very much. Thank you for your service and for sharing that with us.
Hi, good evening. I know that you've seen me before, and it's been a couple months since I've been here, but I can tell you that has been a busy couple months with lots of ER trips for our family. And the reason why I'm here is I want to tell you a little bit about especially the last 2 ER trips. I will never go back to Troy Beaumont. My understanding in talking to people is that there may be a meeting with some hospital administration, and I can tell you that's desperately needed. I took my son to Troy Beaumont 15 days ago. He was approved for the face-to-face program, which I can tell you is crap. I'm not a big fan of that program, but with what we're dealing with, it's either that or nothing. He gets discharged from the hospital. We get there the next morning and they say they won't accept him. My son's too aggressive. So no services. So we went through a week of mobile crisis being out at my house, mobile crisis being at the school, mobile crisis meeting us other places because my son's behaviors were out of control. That culminated in us going to Troy Beaumont last Tuesday, so 8 days ago, and the social worker basically said it's behavioral, he sent him home. Within 5 minutes of me being home, he attacked this precious little girl right here, and she was hurt because the social worker didn't do their job and they didn't do a proper evaluation of my son. I know what he's capable of because we've been through it. We've been through 52 stabs to his arm with a screwdriver. We've been through him trying to get knives and stab other members of the house. I've been knocked down on the ground. I've been cut open. I've been through so much with him. And when I realize he needs help, I try to get help, and then it's trying to get help is extremely challenging. I know he's been in the hospital 11 times. I get that. But sometimes that's what's needed because we need a safe place to have a medication adjustment. Long story short, I took him to Children's. He spent 6 days in the hospital at Children's waiting for an inpatient bed because there are not enough beds in the state of Michigan for the kids who desperately need them. That's 6 days of work. Dana can tell you the work that we do because I'm also an attorney. I do a lot of court-appointed work. It's very hard to find coverage. Very hard to find coverage when I'm stuck at a hospital. Thankfully, Children's did allow me to leave. I was able to work and just check in with them via phone and then come down once or twice a day when my schedule allowed for that. And so I am thankful that Children's did work with me this time. He is currently at Kingswood where he is getting the help that he needs. I don't know what the board can do to change the process or talk to some of these social workers because quite frankly, from a liability standpoint, I believe that social worker is on the hook for the injuries that my daughter sustained during that attack because there was an improper evaluation done. Had they had mobile crisis come out and called Macomb CMH for that evaluation, that team would have said, we have seen these outrageous behaviors over the last 3 weeks that we've been going to her house on an almost nightly basis, and a proper evaluation could have been done, and that attack could have been avoided. And so that's why I'm here, is because there need to be some changes made, and these hospitals need to understand that it's not just looking at one little incident. They need to look at the history and see what this kid does and how he's behaving and when we get to those escalation points, because I can tell you my whole team, including myself, can see it coming. It's like a train wreck just waiting to happen, and you know it's going to happen, you know it's coming, but you can't stop it. The other thing that I wanted to talk about is there's been a lot of turnovers with the psychiatrists at CMH. So currently right now, because I was at the hospital with my son, her psychiatrist appointment had to be canceled because at that point I was at Troy Beaumont and I can't leave if he's there unless they were to admit him to the pediatric floor. The next appointment I can get her is for January 12th. She runs out of medications Thursday. There's no emergency appointments available because no doctor has seen her and they need an hour-and-a-half appointment to do a full psych evaluation on her, which, mind you, she's had 3 in the last year because the psychiatrists are turning over that quickly. We had Dr. Vinch, then we had Dr. Post, then we had Dr. somebody who she never even seen, and I don't even know who she's supposed to see on the 12th. And so now I have to scramble to see if her pediatrician will prescribe her the psychiatric meds that she needs to help her. And so we just end up in these situations, and I don't think you guys understand what we as parents go through. And I want to thank you for the work that you do, because I can tell you that my peer support special person that comes to my house has truly been a blessing. We have laughed together, we have cried together, we have just screamed together because we know what's going on. And Her son is a lot like my son, and so she understands. And I can tell you, of all the people on our team, she gets it the most. We have a new case manager, Sherelle, and I really want to say she's been great. And I said to Nancy, I said, Sherelle doesn't have to tell me, but I can tell you that she has some personal experience dealing with a child who has issues, and whether that be her child or somebody else. I just knew, because you know when you're talking to somebody who gets it. You know when you're talking to somebody who has been in your shoes and understands the battles that you're getting. And not only do I have to battle to help get him services or hospitalizations when it's needed, but we're currently battling with the school district because he should be in Utica's SEED program. He should have been 3 years ago. But instead, he gets suspended over and over again because we can't even access those services. He's currently getting evaluated when he gets out of the hospital for that program, which should help with some of the behaviors. But the mobile crisis team has been out to the school with the issues there. They've been to our house. I don't know when that meeting with the hospital staff is going to happen, but they need to be aware that they need to be doing proper evaluations, because had they asked him what his intentions were, he would have told them, just like he told Bob from the mobile crisis team, I will go home and I will hurt my sister. That was his intentions, and that is what he said all 6 days that he was at Children's Hospital. And so that makes me nervous to bring him home. And I may not have given birth to these 3 kids, but they're my kids, and I love them with every fiber of my being. And they're mine. I've had her since she was 18 months old. I've had her brother since he was 4. And then their cousin Dakota, who's sitting over here, I've had him since my mom passed away 2 years ago. And so it's not easy. It's definitely a challenge, but we're here to try and help them the best that we can, because we can't change what they've been through. All that we can hope is that we can change their future. Thank you for hearing me. Come on.
Thank you for sharing. And if you haven't already done so, if you could sign in over at the that side wall there, and somebody will get back with you with answers to some of your questions and issues. Thank you for sharing. Is there anyone else that would like to address this board?
Good evening, everyone. I'm Sean with CO, just to give the monthly report. Before I start, I'd like to read our mission statement that we believe that all people are entitled to respect, dignity, independence, community, integration, and the opportunity to make choices in their own future. For our individual served update, all programs will be hosting a holiday dinner. Santa will be visiting to deliver presents for all of our individuals. This year, everyone will receive a new lunchbox with goodies inside. Each location has held fundraisers that will be used to purchase the goodies for each lunchbox. The monthly safety topic for November is on lifting techniques, which is stapled to my report you all have. The Michigan-made micro business from Clinton Township has handmade each board member a holiday ornament. For our community center update, at our Clinton Township location, they had a fundraiser at California Pizza Kitchen, raising over $130 for holiday presents. Today, a parent from our skill building classroom will be providing and catering the holiday dinner for the whole building. At our Anchorville location, we just acquired a minivan. Also received a $100 donation from community members, and also receiving a $300 donation to become a sponsor from KH Attorneys at Law, which was provided through Ryan Fantuzzi. Thank you for that. At our Mount Clemens location, I'm sorry, before I move on, I do have a certificate for Ryan as part of our sponsorship program. Well, can I approach the bench?
Yes.
No.
At our Mount Clemens location, we held a fundraiser at Buffalo Wild Wings, raising over $131 for holiday dinner and presents. They also held a pizza party for our individuals. At Washington, they raised over $900 with their Dinner with Santa fundraiser. This money will also be used for holiday dinner and presents. Our stakeholder update, CEO just completed our CARF survey, and we're pleased to announce that our program met at a 99.75% of the 1,200 standards that are reviewed. Our surveyors said that they were impressed with our organization. They've been conducting these surveys for 23 years, and their remarks about CEO were that they've never been to a more organized operation, and we're very welcoming and knowledgeable. We did tape the exit interview. It will be on our website soon. At CEO, our employee retention rate for November was 94%. Myself and CEO all wish you a very happy holiday season. I have a Christmas card thanking everybody. I'm wishing everybody Merry Christmas. And I'd like to personally thank everybody who reached out for our CARF audit, and those who couldn't make it, I still appreciate it. And thank you for calling with my director as well, Dave. And then I have calendars from CEO for everybody too. So Merry Christmas, everybody.
Oh, well, thank you, Sean. Over my many years of seeing crafts and everything, I thought I'd seen it all, of everything that could be made with pasta, but a poinsettia that's quite incredible. That's cool.
I know, I really didn't even want to hand them out tonight. They were pretty good quality.
Is there anyone else that would like to address this board? Please identify yourself. You have 5 minutes.
Well, I won't need that long. Hi, I'm Mike Dow from Acorn Health, the Autism Centers of Michigan. Figured since I drove all the way down from Traverse City to attend tonight, I at least should say hello. So we're agenda item 7B. I just wanted to say, introduce myself and say thank you. I'm here with our clinical director from Oakland County, Lindsay Traurig, and also from Crawl, Walk, Jump, Run, Kathleen Lewandowski. So we're really excited to be serving Macomb County and providing ABA services and treating those on the ASD, diagnosed with ASD. We intend to do so with the same passion and commitment that we currently work in about a dozen other CMHs in 35 or so counties across the state. So thank you, and we're really looking forward to working with you. That's it.
Great. Thank you for being here and introducing yourselves. It's always nice to put a face with the names that we see on contracts and things. Thank you.
Likewise. Thank you.
Anyone else? Is there anyone else? Seeing none? Oh, did.
Well, since you said I had to sing for my dinner, I thought I'd better follow through on that. As you know, this is most likely my last time before this board, at least as the Director of Substance Abuse for the agency. I've a lot of things that got a lot of memories, a lot of things that are going through my mind these days. I can't control them all, you know. But one of the things that occurred to me one day is for some reason I decided that I think it was a boring meeting I was sitting in. Not that we had many of those. It might have been one of these. No. And I started thinking about how many board meetings have I attended in the nearly 17 years that I've been here. You know, and I just kind of, conservatively came up with about 400. That's for the committee and also for the full board. And then I started looking, and then I started thinking, well, what about the number of I always forget what the regional meetings that we have on a quarterly basis, and how many of those I've gone to, just about 150. And then all of the conferences that I've attended and shared with you, and some of the other forums that I've been, and all of that sort of figure. So I figured I've got about 1,000 hours that I've spent or more with board members at some level or another, and which is, that's about a half of a work year. For somebody, that's a lot of hours. I can go further on that on all the other boards that I've been before I came here, but That's more in like the 1,500, 2,000 range. So anyways, as part of that, I've gotten to know each of you and your predecessors to varying degrees, but it's always been a very positive kind of an experience. Not all the meetings, sometimes it gets contentious, but nevertheless, the thing that I've always been impressed with is all of the people that have been on this board over the years and continue to be here. So we have a lot of dedicated people, and people really care about, when it all comes said and done, it all comes down to the people that we serve. And, that makes it easier for us to work in that environment. It's more of a supportive environment. It's not, and I certainly appreciate, speaking for my staff, how happy we are that you've been as supportive as you have for substance use. But it's not just substance use. We're one big agency. It's substance abuse and it's mental health. And they're all the people that we serve. And, that I take that with me, and that's been very gratifying to be part of that. When I leave this agency, I leave a lot of good people, a lot of people on the board, a lot of people that I work with, I think, the people of the agencies that we contract with. That's going to be the hard part about leaving. I feel pretty good about what our division is at, given the challenges that we have. Still got many ahead of us. I really thought we might be able to solve the opioid problem before I left, but I think that's going to be around for a while. So, but I think we've got good, competent staff and a good, again, supportive board. So I want to thank you for all of your support and for the time that we spent, for getting to know you. Thank you. I can't be funny. It's very emotional, so.
Oh, thank you.
Thank you.
Thank you very much, Randy. And you said, you mentioned the opioid problem still being around here, but you have made a difference in the lives of many, many people who, for them, are now in recovery. And
Yeah.
it is not the same problem as it was before in their lives. So thank you.
Thank you.
Anyone else from the public? Seeing no one else, just a reminder to the board members, I still need this evaluation. If you please bring this here. And, Laura, you had something?
Yes, I have something. I have something for the two women that take care of us
Yeah.
on a yearly basis. Still birthday month too. Here you guys go. Thank you for everything you guys do for us. We appreciate it.
Yes, it does. It's very nice. You might want to offer
That
to,
is really nice wrapping.
yes.
Thank you.
Can't unwrap it now, you have to leave it.
Right, or you may want to help them carry their things out, yes. And we do appreciate all the support that you give to us, so thank you again. Then that concludes our meeting. Item number 14, adjournment. This meeting is adjourned. Thank you, everyone, for being here and for traveling many miles.